Over the course of my medical practice, I have clinically guided numerous female patients in the therapeutic practice of autosexual activity or manual self-pleasure. It is an exceptionally fulfilling aspect of my profession. Many women present to my clinic with a variety of challenges concerning sexual function and satisfaction. In a significant number of these cases, modifying their approach to self-stimulation constitutes a crucial component of the therapeutic solution. Therefore, if you are a woman over the age of 60 seeking evidence-based advice on self-pleasure, this informational guide is for you. My name is Dr. Lily Stones, and I produce educational content to assist you in achieving your optimal intimate wellness. Today's presentation is specifically for women, for all the discerning, receptive ladies who wish to enhance their private moments with greater pleasure, deeper satisfaction, and, indeed, more consistent orgasms. I encourage you to remain engaged until the conclusion, as I will be providing a comprehensive guide to digital self-stimulation, including a final technique that often proves transformative, whether integrated into foreplay with a partner or as the primary focus. Manual stimulation can be profoundly pleasurable when performed correctly. In fact, with the appropriate technique, a woman can achieve orgasm solely through digital stimulation. The remarkable functionality of the hands lies in their articulation. They bend, adjust, and can scale from a single digit to 2 or even 3. This inherent flexibility provides a level of control far superior to that of any rigid, linear object. Your fingers are potent instruments of pleasure, and today I will demonstrate their precise and effective use. Before we proceed, I wish to offer an important reassurance. If your body has undergone age-related physiological changes, if you experience increased vaginal dryness, heightened sensitivity, or a diminished responsiveness, this does not signify the end of your capacity for pleasure. It simply indicates that your body now requires a modified approach. Once you acquire the appropriate techniques, you will be astounded by the potential that remains. Consider this an opportunity to learn a new, more nuanced language with your body. You possess a foundational understanding. We will now add the finer details. The subtle shifts in rhythm, the gentler applications of pressure, the clinical secrets that can elevate the experience from merely pleasant to truly unforgettable. And here is the most beneficial aspect. Every technique I will be sharing with you today can be practiced in the privacy of your own space, at your own pace, without any external pressure. This process is about you, about cultivating moments of self-intimacy that leave you feeling fulfilled, radiant, and more deeply connected to your own physical self than ever before. Let us begin. Prior to initiating any physical contact, there are several simple yet powerful preparatory steps you can take for your body and mind. These steps are instrumental in differentiating a routine experience from one that leaves you feeling profoundly vital. That is our next focus. Before we delve into the 5 techniques themselves, let us address an essential prerequisite preparation. This extends beyond simple hand hygiene, though that is of paramount importance. It involves preparing your entire self, both physiologically and psychologically, so that when you initiate touch, your body is receptive. Begin with the fundamentals. Always wash your hands meticulously with warm water and soap, paying close attention to the area beneath the nails. The genital tissues are exceptionally delicate, and even a microscopic abrasion can cause discomfort. Maintain short, smoothly filed nails. If you wear rings, it is advisable to remove them beforehand. This is not about being fastidious. It is about establishing a safe clinical environment where your body can relax without apprehension. Next, let us discuss lubrication. Post-menopause. Many women experience vaginal dryness, a condition which can manifest even during a state of arousal. This is a direct result of declining estrogen levels, which causes the vaginal tissues to become thinner and more sensitive of a condition known as vulvovaginal atrophy. The solution is not to force through the discomfort, but to work synergistically with your body. Always have a trusted lubricant accessible. A quality water-based lubricant is safe for frequent use. A silicone-based formulation offers greater longevity and a silkier texture. Some women also find natural options like organic coconut oil beneficial for external massage. What I do not recommend, particularly post-menopause, is the use of saliva. It evaporates too rapidly and can introduce oral bacteria to the urogenital tract, potentially increasing the risk of urinary tract infections. Your body merits a higher standard of care. Now, let's prepare the mind. Pleasure cannot be achieved in a state of haste. If your thoughts are racing or you are holding tension in your shoulders and hips, your pelvic floor muscles will reflexively mirror that stress. Therefore, allow yourself a moment. Practice diaphragmatic breathing. Inhale slowly through the nose and exhale through the mouth. Visualize each exhalation relaxing the deep musculature of your pelvis. Even 2 to 3 minutes of deep, steady breathing can facilitate a shift from a cognitive state to a sensory one. If you are familiar with Ayurvedic practices, you might warm a small amount of sesame or coconut oil between your palms for a gentle abdominal massage or application to the inner thighs. This is not merely about tactile sensation, it is about communicating to your nervous system, I am safe. I am being cared for. I am ready to experience pleasure. One final point: positioning. Many women over 60 report avoiding self-pleasure due to joint stiffness or arthritis in the hands. If this applies to you, please know that ergonomic solutions exist. Try reclining with a small pillow beneath your hips for support, or place a cushion under your knees if seated. Utilize whichever hand feels stronger and more dexterous on a given day, and do not hesitate to pause and stretch your fingers if they become fatigue. The objective here is not performance, it is enjoyment. When you prepare your body and mind with such care, every subsequent touch is amplified. And that is precisely the state of readiness we need for the first technique. A step many women overlook, but one that can be transformative. Now that your body and mind are prepared, we begin with the first technique, one that is too frequently omitted: preliminary stimulation. In your younger years, perhaps you were more goal-oriented. You might have proceeded directly to the clitoris or to vaginal insertion, operating under the misconception that faster was better. However, post-menopause, your body has different physiological requirements. Blood flow to the vulva, vasocongestion, occurs more slowly, tissues are thinner, and arousal requires more time to build. This does not equate to diminished pleasure. It means you deserve greater patience. And that patience is invariably rewarded. Begin away from the genitals. Allow your fingers to trace paths over your thighs, your abdomen, your hips. Use slow, deliberate strokes, as if you are painting your skin with warmth. Do not perceive this as a delay. View it as priming the canvas before creating the masterpiece. Each stroke awakens cutaneous nerve endings and encourages increased blood flow to the pelvic region. When you feel ready, allow your touch to hover closer, perhaps over your undergarment or a piece of soft fabric. Gently press your palm against your vulva. Hold. Release. Hold again. This gentle, pulsing pressure, even through a barrier, creates waves of anticipation. The clinical beauty of this preliminary phase is that it builds desire, and desire intensifies every subsequent sensation. If you enjoy a playful approach, trace the seams of your underwear with a fingertip. Draw slow lines across your inner thighs, just brushing the skin, and then retreat. Observe your body's physiological response. Perhaps you feel warmth spreading or a soft, deep ache of longing. That sensation is a positive indicator. It is your body's way of communicating. Yes, I am awakening. I cannot overstate this. Preliminary stimulation is not filler. It is fuel. It is the very process that engorges the clitoris, the labia, and the vaginal introitus with blood, which makes the subsequent techniques not only possible, but profoundly powerful. And here is a clinical insight. The more time you invest in teasing, the less effort will be required later. By the time you transition to direct genital touch, your body will already be humming with sensation. So, linger here. Remain curious. Allow anticipation to build, because the next move, clitoral awakening, is maximally effective only when you provide your body with this crucial head start. Once your body is vibrant with anticipation, it is time to awaken the epicenter of female pleasure, the clitoris. But before you proceed directly, allow me to remind you that at our age, the clitoris often requires a gentler invitation than it might have years ago. Many women in their 60s and 70s discover that stimulation, which once felt pleasurable, can now feel overly intense if approached too quickly. Slower, softer buildup is key, and this is a perfectly normal physiological change. Begin by exploring the clitoral hood, the small fold of skin that partially covers the clitoral glands. Instead of applying pressure directly to the glands, rest your fingertip just above or to the side and make minute circular motions. Imagine movements smaller than a coin. The key is subtlety, not pressure. This technique keeps the nerve endings stimulated without overwhelming them prematurely. You can also try a gentle side-to-side stroking motion, like brushing crumbs from a surface, or a slow or round-the-clock motion, touching lightly at the 12, 3, 6, and 9 o'clock positions around the hood, then filling in the spaces between. Each vector of movement stimulates different nerve bundles. As you experiment with these patterns, pay close attention to your body's biofeedback, a sharp intake of breath, the subtle arch of your back, the involuntary tilt of your hips. These are all positive physiological indicators that your clitoris is responding beautifully. If, instead, you experience hypersensitivity, withdraw slightly. Broaden your touch by using the flat pad of your finger instead of the tip, or return to stroking the inner thighs before re-engaging. And do not be afraid to experiment with rhythm. Some women respond best to steady, repetitive strokes. Others prefer variation, such as switching from circles to gentle taps and back again. The clitoris contains over 8,000 nerve endings, and each woman's response is unique. The advantage of self-pleasure is the opportunity to discover your own unique response patterns without any pressure. If you wish, apply an additional drop of lubricant here. Lubrication reduces friction, and for post-menopausal tissue, that translates to greater comfort and less irritation. Think of it as providing your clitoris with a soft cushion of glide, allowing it to focus solely on pleasure. Allocate ample time to this stage. There is no stopwatch, no finish line. Clitoral awakening is not a race toward orgasm. It is about slowly building waves of sensation until your entire body feels alive. When you are ready, we will proceed to the next step, moving from external to internal, exploring the incredible potential of intravaginal touch. Now that your clitoris is aroused and responsive, you may feel an inclination to explore internally. Intravaginal touch can introduce a new dimension of fullness and pressure, but it is critical to approach it gently, especially after menopause when tissues are thinner and sometimes more delicate. First, ensure your finger is well lubricated. A dry finger against post-menopausal tissue can feel abrasive or even painful, which is contraindicated for pleasure. A generous application of lubricant makes a significant difference. When you are ready, place your fingertip at the vaginal opening and pause. Simply resting there can feel intimate. If your body signals receptivity, slowly introduce one finger. Do not rush. Insert only as far as feels comfortable. Once inside, pause again. This allows your pelvic floor muscles a moment to accommodate and relax around the new sensation. From this position, attempt the classic "come here" motion. Gently curl your finger toward your anterior abdominal wall, just a centimeter or two inside the vagina. This light pressure stimulates the anterior vaginal wall, an area where many women report heightened sensitivity. Move slowly. Explore small arcs, both superiorly and laterally, noting what sensations are pleasurable and which are not. Remember, this is not about thrusting in and out in a manner similar to a phallus or a toy. The unique advantage of your finger is its ability to articulate, to find specific angles, and to modulate pressure with precision. That is what makes it so effective. If you notice any burning, dryness, or sharp pain, cease the movement, withdraw slightly, or return to external stimulation. Pain is your body's signal requesting patience. Sometimes, more lubricant or a brief pause is all that is required before trying again. And let me reassure you, not every woman enjoys internal stimulation, and that is completely normal. Some women prefer to focus entirely on clitoral stimulation, while others enjoy the combination. There is no single correct method, only the method that is right for you. If internal touch feels pleasurable, continue with it. Allow your body to be your guide. Feel the gentle stretch, the warmth, the sense of fullness. When you are ready, we will add a new layer, blending this internal touch with the external clitoral stimulation you have already cultivated. This is where the experience can become truly exciting. Now that you have explored both external and internal domains of pleasure, it is time to integrate the two. For many women, particularly after 60, this combination is where the deepest, most gratifying sensations are discovered. The area commonly referred to as the G-spot is located approximately 1 to 2 inches inside the vagina on the anterior wall toward your abdomen. Anatomically, this corresponds to the urethrovaginal sponge. When you are aroused, this tissue may become slightly spongy or ridged to the touch. Not every woman perceives this zone in the same way, and not every woman finds its stimulation pleasurable. But if you do, it can create an incredibly full and powerful sensation. Begin with the "come here" motion we practiced earlier, gently curling your finger forward. Once you have located that slightly different texture, establish a rhythm. Slow, steady strokes or light taps can be effective. Small, precise movements are highly effective here. Forcefulness is not required. In fact, gentle and consistent stimulation is almost always more effective. Now, for the integration. With your other hand, or even just the pad of your thumb, if it is ergonomically comfortable, return to your clitoris. Maintain external touch over the clitoral hood while your internal finger continues its rhythm. This is what is known as blended stimulation. For many women, it is the key to unlocking orgasms that feel deeper, stronger, and more holistic. Pay close attention to your body's physiological signals, a quickening of your breath, the gentle elevation of your hips, and involuntary vocalization. These are all signs that you are on the correct path. If any sensation feels overwhelming, simply lighten the pressure or revert to solely clitoral touch. Remember, there is no rule book. You are in complete control. What matters most are rhythm and patience. Your body craves consistency. It is about finding a stimulus it responds to and then maintaining it long enough for the sensation to build. Too much variation or experimentation at this stage can cause the wave of arousal to dissipate before it crests. Blending clitoral and G-spot stimulation is a powerful technique, but it is not the ultimate secret. There is one more move, the final step that synthesizes everything. And it is the reason women in their 60s and 70s often rediscover a level of sexual response they believed was lost. That is what we will explore next. We have arrived at the final technique. I call this one the Lighthouse Principle. Because just like a lighthouse beam that shines with unwavering consistency, this move is about identifying what is effective and then maintaining it. Here is the clinical truth. The most significant error women and their partners make is altering the type of stimulation right at the precipice of climax. It is a natural response to excitement to think a change is needed, but that sudden shift can actually cause the orgasmic sensation to recede. Your nervous system requires steadiness to cross the orgasmic threshold. Therefore, once you discover the stroke, the rhythm, or the pressure that elicits a definitive yes from your body, do not change it. Keep your hand position, your pace, and your pressure precisely the same. Treat it as a lighthouse signal, constant and unwavering, guiding your body safely to release. Breathe in coordination with it. Deep, steady breathing can help relax your pelvic floor and allow the orgasmic wave to travel throughout your entire body, not just your genitals. Allow your thighs to tremble. Allow your hips to move. Allow yourself to vocalize. This is your body opening fully to its own pleasure. And if the orgasm feels less intense than it used to, do not pass judgment. Your body is different now. Every release is still healing, still nourishing, and still proof that your capacity for pleasure belongs to you. However, you may be surprised. Many women in their 60s and 70s report to me that with this steady, lighthouse-style approach, their orgasms became deeper and more satisfying than they had ever anticipated. This is the technique that ties everything together. Preliminary stimulation builds anticipation. Clitoral awakening stirs sensation. Internal exploration adds fullness. The G-spot blend amplifies it all. And the Lighthouse Principle allows the wave to finally crest, steady, strong, and completely yours. But before we conclude, there is one last step that is too often overlooked: the afterglow. What you do post-pleasure can be as important as the buildup. Let's explore that together. So, you have explored the 5 techniques, and perhaps you have experienced that powerful release. But your journey does not conclude at orgasm. What follows is equally important: the afterglow, or the resolution phase. Immediately following pleasure, your body is flooded with hormones like oxytocin and prolactin, which calm stress, lower blood pressure, and soothe your entire nervous system. Instead of abruptly moving on, Give yourself the gift of remaining in that neurochemical glow. Lie back for a moment with your eyes closed. Place one hand on your abdomen and the other over your heart, and breathe slowly. Feel the warmth spreading through you like ripples across a pond. This is your body's homeostatic response, thanking you for the care you have just provided. You might enjoy pulling a soft blanket around your shoulders, sipping a warm cup of herbal tea, or even journaling a few words about your experience. Think of it as integrating the experience, reminding yourself that self-pleasure is not merely a physical act, it is a form of emotional self-care. For women in their 60s and 70s, this integration step can be the most healing of all. It reaffirms that intimacy is not dependent on anyone else. It belongs to you. And every time you claim it, you reinforce your own vitality. So, let's recap. We began with preliminary stimulation, the fuel for arousal, then clitoral awakening to gently spark sensation, internal exploration to invite fullness, the G-spot blend for deep, combined pleasure, and finally, the Lighthouse Principle, the steady rhythm that carries you over the threshold. Together, these moves form a clinical map back to your own body, irrespective of your age. If this video has resonated with you, I would be pleased if you would share your thoughts in the comments. What part was most enlightening? Have you utilized any of these techniques before? This community serves as a safe space for women to learn from and support one another. Your words might encourage someone else to begin her own journey of rediscovery. And if you found value in this presentation, please subscribe. Each day I share new conversations about women's intimate health, blending the best of modern medicine with gentle, natural practices, so that you can live your most confident, joyful, and vibrant life. Remember, your body's history is not behind you. It is still yours. It is still alive. And it still deserves pleasure.